it's Dr. Reams with Dr. Reams Concierge PT. I'm here with Tayler, who works for Biotab. So he's going to tell us a little bit about that.
All right, yep, I'm Tayler. I'm with Biotab Healthcare. I'm the East Tennessee rep. So we supply pneumatic compression pumps, or commonly called lymphedema pumps. So do you want to demonstrate putting it on?
Yeah, so we're going to kind of put it on as if I was the patient, right? And he's going to talk through as it's working on me, what it's doing, what it's like, all of that stuff. So if he comes to your house to do a demo, you have a little better understanding. So.
All right. So this is the upper extremity garment. This is going to be for swelling in your arm, truncal area, under your armpit. You just slide your arm in there. Yep. And then I'll wrap this around and zip it up. So just real easy zips up here in the front. And then when you're doing it by yourself, you can slide your arm out here. There's multiple different sizes, of course, but you can slide your arm out here, free this hand, and then work that zipper by yourself.
Yeah.
And then this Velcro here, if you'll spin around for me. This Velcro can be adjusted. So we'll cinch this in tight for you. And if you get smaller or expand for any reasons, that can be adjusted.
Yeah.
So then you would get your hand back down in the garment there, sit it propped up there, sitting just like that, and then we'll turn the pump on here.
So part of his job is when he comes to do the demo, is to make sure the right size fitting, that the pump is set up so it's very easy for you to turn on and get started, okay? Ever any questions, they're here to help.
Yep, super easy to use, very, very simple. There's a button here, I'm not sure if you can see, but there's just a red button here on the pump. So all you'll have to do is zip yourself into it and press one red button to turn it on. It's going to start a timer here for 60 minutes. So typically we're using the pump about an hour per session, 1 to 2 times a day, depending on the severity of your swelling. It's totally safe to use up to 2 or 3 times a day, but usually about an hour per session. You can shut this off at any point. So we've got it started here. Just like I said, hit that red button. If you need to get out of it for any emergency or use the restroom or anything, quite literally just unzip yourself out of it if you need to. If you can wait a couple of seconds, you'll just hit the red button there to stop it. And then it'll take a couple seconds, it'll deflate, it'll let go of your arm, and you can unzip out of it. So
you guys can see as he's talking, this started off at my hand. There's little chambers here, right? So it filled up at my hand, then went here, and it's slowly working its way up.
Yep, exactly. So 8 different chambers here, just starting with the highest pressure at the hand here. So it's a little bit more pressure at the hand, then a little bit less, a little bit less, a little bit less, and just kind of pushing that fluid forward. Any of your swelling all the way from your fingertips up your arm, it's going to work right here underneath the armpit, right under those axillary nodes.
Right where it was right then.
It's going to come across the breast and down the side. And then the garment is totally symmetrical as well. So these chambers across the breast and down the side are going to do the exact same thing on the back side. So a lot of patients don't even realize sometimes that they have swelling back here on the back of their shoulder or along the back side here. This garment is symmetrical, so once you feel that pumping up in there, you might notice some relief that you never even knew you had. So,
or that wonderful, bra bulge that we all like to call as bra bulge. Sometimes with some of you all, it is just swelling.
Yep, exactly.
Yeah, so it kind of deflated a little bit to start over, right? And is now working its way back up.
Exactly. So it's 5 seconds in each chamber, starting here at the hand. So 5, 5, 5, 5, 5, all the way through all 8 of them. So 45 seconds in total. And then it'll release for 5 seconds and totally deflate, give you a little break, and then it'll start back over with another cycle, just constantly pushing that fluid in and down.
Yeah. And so this will turn off after about 60 minutes?
After the 60 minutes, it'll shut off on its own, yep. So if you fall asleep, take a nap or anything, it'll shut off on its own.
Yeah.
If we wanted to adjust the timer to 45 minutes or 30 minutes, we could do that as well. But like I said, if you want to leave it at 60 and then just hit the red button and shut it off when you're ready, you can do that too.
Okay. So this is kind of the general setting. There is for some of us who need to kind of clear the upper area first, so those lymph nodes in the armpit or whatever, get those kind of revved up, ready to go to take on this fluid. There's a setting for that.
Exactly. So that's the pre-clearing function. So the pre-clearing function is going to be for the first 10 minutes that you turn the pump on. Chambers 6, 7, and 8, which are right under the armpit here, across the breast and down the side, are going to massage for the first 10 minutes to decongest these lymph nodes under your armpit here and really open up the pathway to so that when we start pumping the fluid in from your arm, it's got a clear, direct pathway to move that fluid through to help with the drainage. So like I said, for the first 10 minutes, you're going to feel chambers 6, 7, and 8, 6, 7, and 8, 6, 7, and 8. And then it'll start down here at the hand and go all the way from the hand and up for the rest of the time limit.
Yeah, so think of the manual lymph drainage massage that I teach, is we clear all this area first and then go from the hand up. So that's mimicking that, which is great. Now, after the hour goes through, this turns off, right? Am I okay to turn this off right now?
Yep.
Yeah, so you
At
can
any
see.
point, just hit the red button.
Thinking about it.
Give it a little harder push there.
There it
you go.
is. It's going to deflate.
It's also good to point out too that all of those buttons are locked. So when I come out to do a demo, we're going to have the settings all preset. There's not going to be any settings that you guys are going to have to change. Those pressure buttons are locked. The setting button is locked. So if you reach over to turn it off and you accidentally hit the wrong button, it's not going to change anything at all. You can't mess it up.
Yeah. And if there's something that needs to be changed, then you call them and they'll come help you.
Exactly. Yep.
All right, so this is deflating now, right?
Yep, you can
so
unzip.
I can unzip, or if I wanted to, have a little more patience and let it deflate more.
There you go.
And get out of it.
And
Now
that's
what's really cool is this is all very easily cleaned.
Yep.
Right?
So
if there's any weeping or wounds or a really sweaty day,
you can just grab a Clorox wipe, Lysol, Kroger brand, anything you got, any kind of good disinfectant wipe, and just give it a good wipe out here. If you get sweat or dead skin, weeping, anything that you may get inside of this garment can very, very easily be cleaned. It's non-stick, non-absorbent, so just really, really easy to use, really easy to clean. Not really any reason you shouldn't be using this. It's very convenient.
So that is for kind of that arm swelling. There are ones that we can do both sides, correct?
Yep.
Yep. So
Or it can alternate. You could flip it around.
Yep.
There's a double vest garment, which could be considered a safety hazard, but if you have somebody there that can get you in and out of it, that's definitely an option.
And also the legs if needed for some of those patients.
Yep. Do you want to show one of those
Sure.
garments?
Show one of those. Very similar concept.
So for the lower extremity garments, it's just a leg sleeve that's going to cover from your toes all the way up to your groin here. It's very easy to get on and off. Just a simple zipper. Prop your leg in there, zip it up, and there's even a couple of handles on the side. You can just pull that up if you need to, like a pair of pants. Sit back in a chair, get your legs elevated, press the one red button on the pump and turn it on. And it's going to mimic the same exact thing. It's going to start with your foot here, fill up for 5 seconds, and then around your ankle, up your calf, around the knee, and the upper thigh. And it's going to release and start over. And it's just, again, constantly, essentially kind of milking that fluid right up out of your legs.
Yeah. And there is a piece kind of for abdominal if need be.
Exactly, yep. Any kind of groin, rear end, hip, lower abdomen swelling, there's a garment that can help take care of that issue as well.
Perfect. Anything else you feel like they should know or be aware of? Or?
With the pumps, there's a 6-year warranty. So through Medicare and Medicaid, the patients are eligible for a new device every 5 years. Commercial insurance is every 3 years. Our warranty is 6 years, so it exceeds that. So you should never have to go without the pump. So if anything happens to it, definitely give me a call. We can send it back for warranty, get it taken care of. There's no maintenance, there's no battery, there's no air filter, there's nothing you have to do to the pump. Just keep the sleeves clean, take care of it. Probably the only thing I would say is watch out for chewing pets. These hoses are pretty tough, but a dog biting into it would be nothing to pop a hole. So other than that, it's real simple, super easy to use.
They make it as easy as possible so you're compliant with it.
Yes, ma'am.
And as you heard him say, we do go through insurance.
Yep.
So between your doctor, myself, and them, we all get on the same page to make sure insurance is on board.
Yep.
Helps cover at least part of the cost of it, depending on insurances.
And most insurances do have really good coverage on these. As more studies have come out, they've just been proven to be so effective that insurances have picked up great coverage on them. And then if there isn't ever any co-insurances or deductibles, our company offers up to 12-month interest-free payment plans. So you could break that down if you, for example, have $360 co-insurance, which is a typical 20% co-insurance. You do that by 12 months, it's about $30 a month, interest-free. So super affordable as well.
Yeah, that's fantastic. Yeah.
Pretty simple setup.
Awesome. Thank you so much, Tayler.
You're welcome.